watching TV9 News and I'm Prajwal D'Souza. For the first time since the pandemic began early last year, India reported over 4 lakh fresh COVID-19 cases in the last 24 hours, making it the first country to cross the grim milestone. The country also reported close to 3,500 deaths. Keeping in mind the worsening situation in the country, the Union Health Ministry has revised and issued guidelines for patients isolating at home. The guidelines also underscore the need for caregivers to maintain safety protocols. So first, how do you identify an asymptomatic or mildly symptomatic case? Now, asymptomatic cases can only be confirmed by a COVID test report. However, if you are asymptomatic, you may not display any symptoms of COVID-19 and your oxygen saturation levels should be more than 94 at room air, according to the guidelines. Who can isolate at home? Not everyone can choose home isolation. Now, according to the Health Ministry, you should be clinically assigned as a mild case or asymptomatic case by a doctor to choose home isolation. You should also have facilities at home to self-isolate yourself from your family members. Having a separate room with a separate attached washroom is necessary. When you choose to home isolate, it is necessary to have a caregiver to look after you. The caregiver should be constantly in touch with the hospital or the treating doctor. Now, for elderly patients above 60 years who have comorbidities including hypertension, diabetes, heart disease, etc., will only be allowed to home isolate after a doctor's evaluation. For patients who have immune compromised status, be it HIV, transplant recipients, people taking cancer therapy, etc., will be allowed home isolation after proper evaluation by the treating doctor. Now, what should you do when you are under home isolation? The one thing you should take care of is to isolate yourselves from others at your home, especially elders and those with comorbidities. Now, you should stay in a well-ventilated room where there is a fresh flow of air all the time. You should also use a triple-layered medical mask, and the mask should be discarded after 8 hours of use or if the mask becomes soiled. Now, if a caregiver enters the room, both the caregiver and the patient may consider using a N95 mask. Mask should be discarded after disinfecting it with 1% sodium hypochlorite. Now, respiratory etiquette along with proper hand washing with soap for at least 40 seconds or an alcohol-based sanitizer can be used. Now, it should be kept in mind that isolating patients' personal items should not be shared with anyone else. The surface should be properly cleaned. The patient should self-monitor and report his health and blood oxygen levels with the pulse oximeter according to the guidelines. Now, what are the treatment according to the guidelines? The guidelines advise that patients may take some of the tablets which are mentioned to my left. The dosage is also given. Now, we do not recommend you taking any of these drugs and you should take them only after consulting a doctor. The guidelines have also warned that remdesivir should only be taken in a hospital setting and only when advised by a doctor. It is strictly inadvisable to take it at home. Regarding steroids, AIIMS Chief Dr. Randeep Guleria said that systemic taking of steroids early should be avoided as they could do more harm. When should you go to a doctor? Now, you should seek medical advice if you have difficulty breathing and if your oxygen saturation levels fall below 94. You should also go to a doctor if you see continued pain in the chest and some sort of mental confusion. Now, what should you do as a caregiver? Now, as a caregiver, wearing a mask all the time is absolutely necessary and an N95 mask may be considered when in the same room with the infected patient. The front portion of the mask should not be touched and discarded if it gets dirty. Proper hand hygiene should be maintained all the time. It is important to use disposable gloves while handling patients and avoid contact with any bodily fluids. Food should be provided for the patients in his room and the utensils should be properly cleaned. Wear a 3-layered mask all the time when cleaning. Now, before and after removing gloves, hand hygiene should be followed. Now, these are important guidelines and should be followed if you or any of your family members are isolating at home. I want to reiterate again that the drugs should only be taken after consultation with the doctor. If you like this content, do give this video a big thumbs up. Don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.